My husband suffers from schizophrenia. His hallucinations sometimes are bothersome and they affect his life. He's tried everything.
It's right there. Don't you see it? It's a bear. It'll be jumping.
I don't see anything.
It's right there. You got any honey? I don't want any honey. Please leave me alone. Go away. Go!
Thorazine, also known as chlorpromazine generically, is in a therapeutic class of antiemetics and antipsychotics. It's in the pharmacologic class of phenothiazines. Chlorpromazine is used as a second-line treatment for schizophrenia and psychosis after failure with atypical antipsychotics. It is also used for hyperexcitable combative behavior in children. Non-psychiatrically, it's used for the treatment of nausea and vomiting, intractable hiccups, preoperative sedation, acute intermittent porphyria. Off-label uses include vascular headaches and bipolar disorder. Chlorpromazine works by altering the effects of dopamine in the central nervous system. It also has significant anticholinergic alpha-adrenergic blocking activity. This results in a decrease in signs and symptoms of psychosis if used for the treatment of schizophrenia. It also provides relief of nausea and vomiting and intractable hiccups, and decreases symptoms of porphyria. Serious life-threatening side effects that demand attention are neuroleptic malignant syndrome of the central nervous system and agranulocytosis. Most common side effects are sedation, hypotension if used intramuscularly or intravenously, photosensitivity, blurred vision, dry eyes, constipation, and dry mouth. Other possible side effects are extrapyramidal reactions, tardive dyskinesia, tachycardia, pigment changes of the skin, rash, lens opacities, galactorrhea, amenorrhea, anorexia, hepatitis, ileus, priapism, urinary retention, leukopenia, hyperthermia, and allergic reactions to the medication. You should not use chlorpromazine if you have a history of hypersensitivity to chlorpromazine or any of its ingredients, a hypersensitivity to sulfates if you're using it as an injectable, angle closure glaucoma, bone marrow depression, severe liver or cardiovascular disease, if you are breastfeeding, or if you are using chlorpromazine concurrently with Pimoid. If you are taking another phenothiazine, this could cause cross-sensitivity. Chlorpromazine should be used cautiously in those with diabetes, respiratory disease, prostatic hyperplasia, central nervous system tumors, epilepsy, and intestinal obstruction. It should also be used cautiously as well in pregnancy because neonates are at an increased risk for EPS and withdrawal after delivery when exposed during the third trimester. Use during pregnancy only if the potential maternal benefit outweighs potential fetal risk. It should be used cautiously in children with acute illness, infections, gastroenteritis, or dehydration as it can increase the risk of EPS reactions. In elderly patients, it increases a risk of mortality in those being treated for dementia-related psychosis. It increases the risk for falls if given at this age group. You want to decrease the initial dose. This drug does have a black box warning of being a Beers REMS drug, which indicates that there are precautions taken for elderly patients over the age of 65. You shouldn't use chlorpromazine if you are taking Pimoid as it increases the risk of potentially serious cardiovascular reactions. Concurrent use is contraindicated. It may alter serum phenytoin levels, decreases pressor effects of norepinephrine and eliminates bradycardia, antagonizes peripheral vasoconstriction from epinephrine and may reverse some of its actions. It may decrease elimination and increase effects of valproic acid, may decrease the pharmacologic effect of amphetamine and related compounds, may decrease the effectiveness of bromocriptine, may increase blood levels and effects of tricyclic antidepressants. Antacids or adsorbent antidiarrheals may decrease absorption. Administer 1 hour before or 2 hours after chlorpromazine. It could increase the risk of anticholinergic effects with antihistamines, tricyclic antidepressants, quinidine, or disopyramide. Premedication with chlorpromazine increases the risk of neuromuscular excitation and hypotension when followed by barbiturate anesthesia. Barbiturates may increase metabolism and decrease effectiveness. Chlorpromazine may decrease barbiturate levels. Additive hypotension with antihypertensives is possible. Additive CNS depression with alcohol, antidepressants, antihistamines, MAOI inhibitors, and opioid analgesics, sedative hypnotics, or general anesthetics should be avoided. Concurrent use with lithium may produce disorientation, unconsciousness, or extrapyramidal symptoms. Concurrent use with meperidine may produce excessive sedation and hypotension. Concurrent use with propranolol increases blood levels of both drugs. Natural drug products that should be avoided are concomitant use of kava, valerian, chamomile, or hops, as it can increase CNS depression. An increase in anticholinergic effects with angel's trumpet, Jimson weed, and scopolia is also possible. Starting doses for this drug in adults are, for psychosis, you want to start at 10 to 25 milligrams 2 to 4 times a day. In children, for psychosis and nausea and vomiting, you'll want to start at 0.55 milligrams per kilogram every 4 to 6 hours as needed. Intramuscularly in adults, for severe psychosis, you're going to want to start at 25 to 50 milligrams initially. It may be repeated in 1 hour and increased up to a maximum of 400 milligrams every 3 to 12 hours as needed. For nausea and vomiting during surgery, 12.5 milligrams may be repeated in 30 minutes as needed. Preoperative sedation, 12.5 to 25 milligrams 1 to 2 hours prior to surgery. With hiccups or tetanus, 25 to 50 milligrams 3 to 4 times a day. In porphyria, 25 milligrams every 6 to 8 hours until patient can take orally. Intramuscularly in children, age 6 months old or older. Intramuscularly for children 6 months old or older. You're going to, for the use of psychosis or nausea and vomiting, 0.55 milligrams per kilogram every 6 to 8 hours, not to exceed 40 milligrams a day. In children 6 months to 5 years old, or 75 milligrams a day in children 5 to 12. For nausea and vomiting during surgery, 0.275 milligrams per kilogram may repeat in 30 minutes as needed. For preoperative sedation in children, 0.55 milligrams per kilogram 1 to 2 hours prior to surgery. For tetanus, 0.55 milligrams per kilogram every 6 to 8 hours. For intravenous use in adults, nausea and vomiting during surgery, up to 25 milligrams. Hiccups or tetanus, you're going to want to start at 25 to 50 milligrams. For porphyria, 25 milligrams every 8 hours. For intravenous use in children, for nausea and vomiting during surgery, 0.275 milligrams per kilogram. For tetanus, 0.55 milligrams per kilogram.
If you suffer from hallucinations from schizophrenia or psychosis, like my husband, don't delay. Talk to your physician about Thorazine.